Welcome to Health Assessment. This PowerPoint series will discuss how we systematically assess our patients from their head all the way to their toes. We'll focus on what we're assessing and what the normal findings of the adult should be. As we move through the body systems during lecture, we'll discuss the abnormal findings for those body systems. The flow of this PowerPoint series is based upon the layout of the book for easier comprehension of the topics. It's not the flow in which we do our assessment. We'll discuss the flow completely separately. Here are the objectives for the end of the series. You're going to identify proper techniques to obtain health history and perform a head-to-toe assessment. You're going to analyze, interpret, trend, and document health assessment findings and recognize the importance and timing of assessments congruent with the patient's situation to deliver safe, effective care. A health assessment is what healthcare providers do when they're trying to find out all about the person in front of them. What is going on with their body and mind, trying to see if they're healthy or not. Depending on where you work and what kind of healthcare provider you are, will depend on how in-depth your health assessment is. As nurses, we do fairly in-depth health assessments, trying to gather as much information about the patient as we can. A health assessment is deliberate and systematic, meaning we are consciously following a flow and set of questions to make sure we gather all the data we need. Health assessments are also holistic. We look at physical, psychological, sociocultural, developmental function, and spiritual aspects of our patient. The data we gather can be subjective or objective. Subjective data is information that is based on the experience and perception only felt by the patient and never reported by the patient. Pain, for example, is subjective. Only the person experiencing the pain can tell us what the pain feels like. Objective data is information we gather that is measurable and directly observed by the healthcare provider. Pulse rate is measured. Respiratory rate and effort is directly observed. A thorough health assessment includes both subjective and objective data. When we do a health history, we're asking questions about the patient's health, gathering subjective information about their past to help us figure out what's going on with them right now. The physical assessment portion of the health assessment gives us the objective data about the patient's body systems to tell us how the body is functioning right now. Why do we do complete health assessments? Well, we use the data we gather to make judgments about what's going on with the patient's body at that moment in time so we can treat them and make them feel better. Once we do things to make the patient feel better, we evaluate those interventions by assessing their health again to see if our interventions worked. We also do health assessments to get a baseline of what the person looks like when we first see them, just like we do with vital signs. This way, we know if they're getting better or worse. We use health assessments to find out what the patient is good at and what they might need help with. One common example of this is ambulation. We assess how well they can walk, and if they need help, we help them out. Health assessments also enhance the nurse-patient relationship. We get very close and personal with patients when we assess them, and we find out things about them others may not know about. The patient is in a vulnerable situation, and there we are to make sure that their privacy is maintained and we support them. Lastly, and most importantly, health assessments help us identify issues occurring inside of our patient, and it's going to allow us to prioritize the issues and help treat and manage those issues. There are different types of health assessments we do as nurses. A comprehensive health assessment is going to be our most thorough health assessment. This is going to include a complete history along with physical assessment. We typically do comprehensive health assessments when a patient is admitted to our facility. All of this data allows us and the providers to figure out what's going on with the patient to make a formal medical diagnosis and treatment plan. An ongoing or partial or follow-up assessment is an assessment that's done at regular intervals, like every time you go see a doctor or with every home care visit a patient may receive. This type of assessment is following up on a known medical issue that's being treated, and we're trying to see if they're doing better or how they're doing on the treatment. A focused health assessment is an assessment that is focusing on one issue or one body part instead of everything. For example, if a patient goes to the doctor with arm pain, the doctor is only going to focus on examining the arm, not the entire body. The entire body isn't having an issue, just the arm. As nurses, we tend to do focused assessments after we do the comprehensive assessment, focusing on the areas of concern for us and focusing on the highest priority areas. An emergency health assessment is a type of rapid focused assessment, just focusing on the areas that are causing life-threatening issues. If the patient goes to the emergency department saying they can't breathe, then the emergency assessment is going to focus on breathing and the lungs. If the patient's in a car accident, we're going to focus on the ABCs, airway, breathing, and circulation. Then, after we know that they have those areas under control, we'll move to a more comprehensive assessment. How often we do these assessments is going to depend on where we work and how sick the patient is, and of course, what our policy says. When we do a health history, we are asking a lot of questions, which means we need to listen to what's being said to us. Anything we miss may be the one thing that allows that person to get diagnosed. We try to get all the information from the person themselves, but sometimes that isn't possible, so we may have to get as much as we can from family or friends. First, we want to ask about the biographical data: name, date of birth, address, biological sex, identified gender, sexual orientation, marital status, occupation, race, religion, etc. We also need to ask about preferred language, spoken and written. All of this data helps us know about our patient and helps us determine if there are any biological or hereditary issues we should consider. We need to ask the patient why they're seeking health care. What is their chief complaint that brought them in? Part of this will include the history of what the thing is that brought them in, like when did it start, what makes it better or worse, what have they done, who have they seen already about this issue. Once we have a clear idea of why they're there, we need to ask them about their past medical history, what diseases and illnesses they've had in the past surgeries, immunizations, allergies, injuries, medications they take, including over-the-counter, and what health maintenance things they've done, like mammograms and vision screenings. This can also include lab and diagnostic results, hospital visits, past medical records, and medical records from previous doctors. This also includes spiritual and mental health. Next, we need to ask about any known family health history. Some diseases are genetic, so knowing what's occurred in the family will help us figure out what's wrong with the patient. Next, we focus on functional health. Do they smoke? Do they use assistive devices like canes and walkers? What social determinants of health do they have, like poverty or lack of insurance, underemployment, environmental concerns like lack of running water and shelter, what their support system is? Do they routinely see a medical provider, or do they only get checked out when something is wrong? What's their nutritional status like? Lastly, we need to assess their ability to complete their activities of daily living, or ADLs. Is the person able to take care of themselves, or do they need help? Has their ability changed recently? Can they ambulate? How far? Do they have any symptoms while doing their ADLs? We ask about all of these areas to help us determine if anything is deviating from normal. Are there any risk patterns or areas of concerns that need to be addressed? Is there a clear medical issue that's obvious, or do we need more data? All of this is going to help us plan our care for the patient. As an ending to the health assessment, I want to tell you that everything we are told or assess has to be documented. Documenting all of this data helps us identify actual or potential health problems, communicates the issues to other healthcare providers, and helps us plan the appropriate care for the patient and evaluate what we provide. If it isn't documented, we don't have any way to see the data. So we might not document the one key piece of data that tells us what's going on, so we may treat them incorrectly and we may cause harm. And this is the end of part 1 of health assessment.